Are you bleeding in your first trimester of pregnancy after going through IVF treatment? Let's have a discussion about why this could be happening today and what you should do. I want to begin this video right off the bat that if you are experiencing bleeding, you need to contact your healthcare provider. They will determine the next appropriate steps to help assist you with possible causes, further testing, perhaps ultrasound that's needed. Please pause this video if you're concerned and call your healthcare provider. Let's dive into some reasons why bleeding after IVF treatment might be common. I personally experienced this. I went through IVF and around 6 weeks experienced some spotting and then a little bit of bleeding. Let's take a look at why this could be happening. So first trimester uterine bleeding is common with IVF pregnancies. The positive news is that studies have not found that it is associated with an increase in incidence of adverse outcomes such as a miscarriage. So just because there's bleeding, it does not always mean that you are miscarrying. There could be other reasons for this happening. One study looked at IVF pregnancies and analyzed 157 pregnancies over a 2-year period that were followed until delivery. All patients were advised to report any incidents of bleeding, even if it was light or moderate. It found that 67% of patients reported bleeding in the first trimester. I was quite frankly caught off guard by that statistic at how common this is and how many of you are experiencing this. I also have to say it's the #1 reason why you guys use my little chat feature on my website. So many of you are experiencing this. It's scary, and I want to validate that for you today. Studies have found that those who go through infertility are not at an increased risk for miscarriage in the first trimester compared to those who conceive naturally. This was reassuring for me to read, for myself, and for my patients. Let's take a look at common causes for first trimester bleeding, whether you went through IVF pregnancy or not. Medications. Many of us who've been through IVF, many if not all who've been through IVF are on medications, and they alone can cause irritation at the cervix to happen, which can cause spotting or bleeding. What am I talking about? Our good old friend progesterone supplements. Those are, well, an adventure in themselves. #2, polyps, fibroids, or other growths that can happen in our uterus or on the cervix. They become irritated and cause bleeding to occur. #3, implantation bleeding, which I have a video on as well. This occurs when embryo or the baby implants into the uterus. Typically, it does not last more than a few days. It's lighter than a normal period, and it's often a different color or a paler pink than our menstrual cycle bleeding, or a rusty brown even. #4, subchorionic hemorrhage. This occurs when the placenta partially detaches from where it was implanted on the wall of your uterus, and subchorionic hematomas form. And this forms an abnormal accumulation of blood between the placenta and the wall of the uterus. These can vary in size from small to large. Once again, this does not determine that your pregnancy is going to end in a miscarriage or end at any point in the pregnancy. These are very common and require careful evaluation and follow-up with your provider. #5, vaginal infections. Common ones include chlamydia, gonorrhea, herpes, bacterial vaginosis, and more. Please be evaluated by your healthcare provider if you have any concerning symptoms of discharge or pain. #6, irritation. This can include intercourse, physical activity, pushing, pulling, lifting, bending, or anything, quite frankly, that can cause irritation in the cervix. #7, if you're carrying multiples, twins, triplets, or more, this can increase your chance of spotting or bleeding in your first trimester. #7, there's no explanation. We don't know why it could be happening, and it hopefully is an isolated event. Unfortunately, it can cause us to be very worried and have fear and anxiety, which is where I want to once again empower you to reach out to your healthcare provider, have a thorough evaluation and workup done. If they're not hearing you, find a new provider who will take a look and examine you and figure out what could be causing this to happen. There's often other lab work that needs to happen, like an HCG, a progesterone level, a thyroid level, and an ultrasound to provide some reassurance for you. If you have other symptoms with your bleeding, such as fever, chills, vomiting, please seek care from your emergency room or call your healthcare provider right away. If you enjoyed today's video, please hit like, hit subscribe for more content on fertility and women's health, and share it with a woman in your life who could benefit from this content to empower them to take back control of their healthcare.